That's all right.
You,
We'll just do it.
Good morning, everyone. I'm Steve.
I'm Scott.
And together we are Backyard Musings, broadcasting from Apple Valley, California. I'm getting my directions mixed up here. Got a really shocking medical thing to tell you today. A new survey reveals major gaps in public knowledge, with many mistakenly believing human papillomavirus, or HPV, only affects women or that symptoms will warn them. Experts stress the urgent need for vaccination, which can prevent up to 90% of these cancers, yet far too few people are taking advantage of it. With HPV-related cancers rising fast, especially in middle-aged men, awareness and action are more crucial than ever. HPV isn't just a concern for women, it's actually more common in men and is driving a rise in dangerous cancers, including those of the throat and tongue. Would you like to know more?
Yeah, this is kind of a concerning topic. So while the human papillomavirus, HPV, is most associated with cervical cancer risk and women, the virus is actually more common among men than women and is associated with rising rates for other cancers that directly impact men. A new survey commissioned by the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute shows that the majority of people are unaware of that.
Yeah, I was unaware.
Yeah.
And I know about HPV in women, but I was unaware about men. Okay. The survey aimed to assess public awareness of this widespread but often misunderstood virus, including how it spreads and its connection to cancer risk. The findings were clear. Most respondents had limited knowledge about HPV, the human papillomavirus, and its long-term health risks. Many also held misconceptions about how the virus is transmitted. This lack of awareness, according to Electra Paskett, PhD, a cancer control center at OSUC, that university that facility that Scott mentioned, it's got a long name, puts countless people at avoidable risk for HPV-related cancers.
Okay, this is a quote. We have a vaccine that has been shown to reduce the risk of HPV infection by up to 90%. That's amazing. This is a powerful tool for cancer prevention and has only been available to us in the past few decades, and we are seeing the impact of those vaccines now through the scientific data. For this survey, respondents were asked if they agree or disagree with some basic statements about HPV to gauge public knowledge. Survey results show that many people think that this is an infection that impacts women more than men. And that's a quote by Paskett, Electra Paskett, PhD.
Yeah. So continuing with the quote, this is concerning because more men are infected with HPV than women, and they could unknowingly spread it to their partners, said Paskett, who also serves as Marion N. Rowley Professor of Cancer Research and Professor in the Ohio State University College of Medicine. Specific results from the survey include, go ahead, Scott.
Nearly half of respondents, about 45%, did not know if HPV was linked to cancers beyond cervical. The fact is, it is the primary risk factor for cervical cancer, but is also linked to rising rates of cancers that affect the tonsils, base of tongue, throat, neck, esophagus, anus, and genitals, according to peer-reviewed scientific data. 42% believed HPV was more common in women. So, fact, HPV is more common in men, but because there's only a test for women, people mistakenly think HPV only affects women, according to the CDC. 40% believe that if you are infected with HPV, you will have symptoms. Fact, many do not have symptoms until after they have cancer. That's not good.
Right. Paskett noted that while the HPV vaccine is recommended between the ages of 9 and 12 for maximum effectiveness prior to potential HPV exposure, it is now available to adults up until age 45. Although the vaccine has been available since 2006, the lack of awareness that it can prevent cancer later in life has slowed progress in preventing these cancers. The CDC estimates that timely HPV vaccination could prevent 90% of cervical cancers alone, and only about half, 56.9% of children who qualify for the vaccine have received it. Among them, more girls and women are being vaccinated than boys and men.
I wonder why that is. Right now, about 42 million people are infected with HPV, and most Americans, 98% of those, have been exposed. The virus spreads through sexual contact, saliva, or ejaculatory fluids, and can spread through childbirth. If the immune system can't kill the virus, however, the cells can change into cancer.
So the Osuk James head and neck surgeon Matthew Old, a medical doctor, cites concerns about rapidly rising rates of HPV-related oropharyngeal, tonsil, and tongue-based cancers, noting that if this trend continues, they could quickly be among the most common forms of cancer in adults between the ages of 45 and 65.
So how do you know if you have this stuff if they're not testing for it?
You got to go get tested, I guess.
You got to ask for the test. I don't ever remember being
Yeah.
test. So recent estimates suggest that oropharyngeal cancer may become one of the top 3 cancers among middle-aged men in the United States by 2045, and the most common form of cancer among elderly men in the next 10 years. Great. Quote, it can take years or even decades for the genetic changes caused by HPV to take effect and transform into cancer, says Old. Quote again, once exposed, there are currently no treatments for HPV infections, and many who are unvaccinated unknowingly carry and spread high-risk strains of the virus. That's why vaccination is so important. Crazy.
Yeah, so there was a big debate about this because it's primarily transmitted through sexual contact. So people were not wanting to vaccinate their teenage daughters under the assumption that my daughter's not going to have sexual contact. Well, kids are kids, and this happens. I mean, even in our religion, we obey the law of chastity, which is not to have sexual relations with anyone other than you're legally and lawfully between a man and woman married, right?
Right.
So,
Crazy if you
but we're human, sometimes we transgress, laws and commandments and stuff. So this applies to everyone, teenage boys and girls, because this is serious. It's cancer. It's not just women, it's men too.
Yeah, and like they said, there's no cure for this right now. So you got it. What do they do? I don't know.
Get checked up for if you're a man, get checked up for throat and tongue cancer. You start feeling swollen, or you start hurting excessively, it's time to get to the doctor and get tested, or get some x-rays for cancer.
Right.
All right, folks, thanks for joining us for this episode. I wish it was happier news, but at least you're informed now.
Yep, that's a good story. Not a good outcome, but a good story. So take care, everyone.